This video illustrates efficient treatment of a very common dental emergency. A middle-aged woman was referred to our office by her friends, who were existing patients of record. She had been having occasional discomfort when chewing over the previous 2 to 3 weeks. She said that cold actually soothed her lower right teeth, yet the pain in them had been increasing. She was worried there might be infection. Examination showed the mandibular second molar to have a corroded and fractured silver mercury amalgam filling. Decay was present and the tooth itself was cracked. Vitality testing determined that the back molar was non-vital, but the front molar tested within normal limits. A digital X-ray image showed thickening of the ligament around the tip of the second molar, calculus or tartar around its gum line, and a contact gap between the filling and the neighboring tooth. The patient was informed of the tooth's condition and that her symptoms were caused by a pulp abscess. Saving the tooth was important to her. Thus, root canal treatment, post-core, and a CEREC crown best fit her long-term goals for oral health, function, and appearance. Emergency treatment was initiated to improve the patient's comfort. Support antibiotics and analgesics were used to help manage her infection until she could be reappointed. At the second visit, endodontic therapy was accomplished comfortably, efficiently, and uneventfully. Then a passive composite core was built up so as to more securely retain the CEREC ceramic crown. During preparation of the tooth for the crown, a Deca CO2 laser helped to refine the gum tissue. Then OptiSpray powder allowed CEREC BlueCam to capture clear and precise optical images of the second molar area, opposing teeth, and bite registration. CEREC software generated a virtual 3D model where the margin in the final crown was easily seen and scribed. The computer then proposed a virtual crown rendering that was efficiently tweaked for shape, optimal fit, and occlusion. The final design was then milled from an Ivoclar Emax block in our MCXL milling machine in just under 15 minutes. After verification of the fit, the crown was custom colored, glazed, fired, allowed to cool, then cemented with multi-link easy transparent cement. The bite was verified for accuracy and very little adjustment was needed. Subsequently, the patient accepted an appointment for the remainder of a comprehensive exam now that she felt that her crisis was over. A subsequent panoramic image showed the marginal fit of the final CEREC crown to be flush and smooth, allowing effective personal oral hygiene and an excellent prognosis for long-term health. The patient remarked that her tooth achiness was completely gone. She said her molar felt perfectly comfortable and beautifully smooth to her tongue. She was surprised that the root canal, build-up, and crown could be completed in a single visit, without the need for a temporary of some sort. This became a segue to reaffirm the benefits of up-to-date technology and to illustrate the tremendous advantage we had in using BlueCam to manage her clinical circumstance effectively. She was pleased with her initial experience at our office. Consequently, use of CEREC BlueCam gave us good reason for celebrating success and doing our best for her.